Hi everyone, my name is Andy. I'm a PhD student at the University of Bristol, and I'd like to share a little bit about my research journey during my PhD so far, which aims to identify ways physical activity could be used to support and improve the mental health of students in further education. The increasing prevalence of mental health issues amongst older adolescents and young adults is a growing public health concern. Physical activity is one potential intervention option, which could be effective and feasible to support the mental health of young people. And while academic settings can be important contexts for intervention delivery, little research has been done in colleges of further education. I hope to contribute through three interlinked research components: a scoping review, which has recently been published, a qualitative study with college staff, and a longitudinal qualitative study with college students. Today I'd like to share some preliminary findings from the second component, the qualitative study with college staff. We aimed to explore physical activity and mental health provision in colleges, student mental health and physical activity engagement, and staff's input for how physical activity could be used to support student mental health in the future. 29 staff from 5 colleges around the southwest of England took part in semi-structured interviews. Within interviews, participants described their growing concern for the worsening mental health of their students in recent years, and the increasing demand being placed on both teachers and college support services as a result. And while participants felt that physical activity could be a useful option for helping support their students, they shared several challenges that need to be taken into account in the future. This included challenges to student engagement with physical activity, such as negative attitudes towards physical activity, timetabling and academic pressures, and a lack of awareness around what opportunities are available to them. And college-level issues with physical activity provision, including financial constraints and funding structures not directly financing physical activity or mental health provisions, a reliance on traditional competitive sport at college, and a lack of integration between physical activity and mental health support services. And finally, challenges at a more sector-wide systemic level, such as a cultural sense that there is no real place for physical activity at further education level, and a lack of specific guidance, frameworks, or incentivization for what colleges should provide from a policy level. Despite these challenges, several suggestions and opportunities for how physical activity could be better used to support student mental health in the future were identified, and we look forward to sharing these in the future. The findings have also informed the next piece of work for my PhD, a longitudinal qualitative study with students, where I aim to hear their side of the story and explore their experiences with physical activity and mental health during college and get their input on potential opportunities for the future. This study is currently underway. The overall goal is to inform future intervention development or policy change at further education level to make a positive impact on the mental health of our young people in the future. Thank you for listening.